My name is Amol Nirgudkar. I'm the CEO of Patient Prism, and I have with me here my very good friend and an incredible marketer in the dental space, Grace Rizza from Identity Dental Marketing. Hey, Grace.
Hi, Amol.
How are you doing?
Good.
Good. And I have Grace here on this podcast to really talk about the impending doom that we think we're in, which is the coronavirus scare, and how it's affecting our dental offices. At Patient Prism, we have made hundreds of calls over the last 48 to 72 hours, talking to our customers about what they're going through. And frankly speaking, there is a lot of fear. And the fear comes from not knowing what will happen. Like each day is different. And what should dental offices be doing right now from a marketing perspective? And everybody has a question. So I wanted to bring you, I love what you do in the space. I love all your videos. I watch them every time you are on Facebook Live. If it's not live, I will listen to the recorded version of it. But I really want start out with talking about what do you think is going on? What are you seeing with your clients from a marketing standpoint? And then we'll just have a discussion.
Well, I will say that there's always going to be opportunity that comes with change. And right now we're going through a pretty rapid period of change. And so we don't want to sit here and talk about opportunity around sickness or illness, but at the same time, we don't want to stick our head in the sand and not have a game plan and not think about how we're going to position our business when these kind of changes take place. So the first thing that I would recommend to any business owner is really take a step back and look at how things are changing and what the public perception is right now. And right now, clearly, the public perception seems to be, anyways, a lot of fear, a lot of uncertainty, and there's a lot of rapid change. Schools are shutting down, obviously. Travel is getting shut down. Big events are getting shut down. And people are starting to retreat. But I will tell you that there was a very long line at Starbucks this morning. And that the things that people want, they're still going to find a way to make it happen. And so at any given time, I think a lot of people are kind of like, this is like an extended spring break for a lot of people. And for other people, there's going to be time. Time happens. Like when you have cancellations in your schedule, you have this extra time. And so the first thing you could do is think about what are you going to do at that time? Because time is such a valuable resource for you. So that's going to give you an opportunity to think about your marketing messages and think about how do you want to communicate with your community when you have these things happen.
It drives, absolutely. I agree with that. I think cancellation is the biggest worry currently because people are afraid to go see their doctor or their dentist because it's sort of not an emergency, right? And so that does create. I mean, obviously, you can't. If somebody is fearful of coming to you, you can't really force them to come in. But what it does give you is the time.
Yeah. We're not going to force anyone to do anything, but we can write the narrative around their perception of our care. And that's where the marketing comes in. So that's where I would encourage anyone to sit down and say, well, what's our narrative? And an example of that would be someone calls in and they say they want to cancel because they just want to play it safe right now. Well, Mrs. Jones, last time you were here, we noticed you had some infection going on. You do need this treatment. I'm afraid that, we want your immune system in the best possible condition, and taking care of your health, inclusive of your oral health, is actually going to put you in a better position. And I do want to tell you, Mrs. Jones, we've taken extreme measures to protect our patients, and these are some of our policies in the practice. And when you play it that way, you can face these conversations with a great deal of confidence. And people need that right now. People need that security right now. If you're the only person that they talk to in their day that has confidence and security around the world, you're providing a whole lot more than dental care to the people around you. So maybe just pause for a second and be the voice of confidence for the people around you.
And even if they don't come right away, what they're going to remember is the goodwill that you've created in their mind, that these guys were by my side in moments of crisis. And it's going to create a tremendous amount of positivity with them and their family. And I can understand over the next week or two, things we have all these new tests, so we're going to see an increase in number of cases, and people are going to be a little bit antsy about that.
Absolutely. I'd say compassion, meet them with compassion and understanding, but also a little bit of logic would be great right now. Like a little bit of logic and a little bit of just confidence, security. The world needs that right now.
Right. No, I agree with that. And so that's one thing. I think I completely agree with you. We have some marketing messaging out there right now that tells people on how to communicate effectively about their safety and compliance with the cleanliness and OSHA stuff. And also one of the tips we recommended is that create somebody in your organization, if it's a hygienist or an assistant, to kind of effectively talk about this stuff, right?
Yeah.
And we have a patient that's concerned about coronavirus coming in for their hygiene appointment, but maybe have a script ready of here's what we're going to say to them consistently, that gives them the confidence that they still are, their dentist actually is aware and has taken all the steps in order to address these things. But getting beyond this, right? There's a subsection of people who are just like, oh my God, I have to shut down my practice. There's people, I need to stop all marketing spend, right? All of it, right? I'm not going to do anything. What are your thoughts on that?
Oh my gosh. How exciting is that? Okay. I know this sounds horrible. I'm supposed to be in this bad mood. I'm supposed to meet everybody at their doom and gloom. I refuse to do it. I'm excited about it. Let everyone pull back. That's when you really have an opportunity to get some really great, it's all competition driven. So, and people still need a dentist. People are always going to need a dentist. Like the infection doesn't go away. The maintenance doesn't go away. Like life goes on. And right now we might be at the peak of hysteria, but eventually it's going to calm down and you're going to have gained a lot of traction when everybody was pulling back. So more than ever, let everyone else pull back. If you're really going to look at the long term, this is when you should be investing. This is when you should be investing in stocks and marketing, and prices are going to drop. Like there's opportunity. And I'm not saying that this is a good thing by any means. I'm not saying that, but just saying if you flip your perspective a little bit, it could pull you out of what I feel like the world around us is trying to push us all into a depression. It doesn't have to be that. It really doesn't.
You're so right. Sometimes doing the counterintuitive stuff, right, is the most important. And but we get gripped by fear. If you look at, for example, the stock market, if you look at who buys during these things, the billionaires are buying stocks at this time, right? People like Warren Buffett and Bill Gates, and these guys are the guys that are buying. But overall, the public is like, I'm gonna sell everything because it's all crashing. Although the analogy is not perfect here, I think, and it doesn't have to be that you're running a brand new implant special or whatever that might be. It could be an education. It could be a piece that educates the public about who you are, what you guys do, and really pushing a positive education and exhibiting leadership in the community.
Yep. And meet them where they're at. People are not necessarily going to be, I think there's a certain percentage of the population that's somewhat resilient to these kind of things and isn't going to change their whole life and all of their activities, despite the fear and the panic that's being circulated right now. There's a certain number of people that are just going on with life as usual. Right. I'm definitely one of those people. And I will say that those people are still going to be, like I said, carrying on. So be there for those people. But then there's also an opportunity, again, I'm saying that word, to connect with the people who are really just wanting to feel safe right now. And it's a fair concern. And so you may actually add to your marketing strategy to have, for instance, a Google Ads campaign around your safety and infection control, keywords around dentistry, because those searches are going to be going up because there's this hyper awareness to safety and infection control. So, we want to be proactive, we want to be reactive, and we want to position ourselves in the best way possible to withstand whatever kind of storm is coming.
On the front of, so from an external marketing standpoint, I think continuing what you're doing, maybe calibrating the message a little bit is probably what you're saying here, which is great. I got an email 2 days ago from a dental publication, which was interesting. And that dental publication they sell lists of dentists for you to market to, right? And they had a coronavirus special, which was very intriguing for me. I mean, I'm like, man, I sent it to my marketing team. I'm like, wow, the messaging around this is pretty interesting. They're saying, we know a business is a little slower right now. We want to support you by giving you this lead list at 25% off. And I'm like, that's creative. That's innovative. That's staying ahead of the competition.
It's probably their same offer that they were putting. They just dropped the word Corona in it and made it topical because everybody's clicking on that word. So might as well go with it, I guess. But yeah, I mean, again, they're calibrating the message to the current climate.
And I'm not saying that it's cheesy. I mean, you're not putting coronavirus special 25% off. That's not what you're trying to do.
No, that's not the message here, friends.
Not the message. It's the message of safety, of leadership, of education, of not getting bogged down by this hysteria.
Yeah.
And giving the community the confidence that you're there to meet where they want to be met.
Absolutely. And also you need to be a leader for your team right now. If you haven't sat down with your team and if you haven't given them some confidence and security in your business and where you're going, like the last thing you want is for your great employees to be panicking and looking for backup plans. And like, you need to be that voice of reason for the people around you right now.
Absolutely. The doctor, the CEO, whoever it is, they need to really instill confidence in their team members that, hey, everything's going to be okay. This is a temporary phase. It's all going to be okay. Look at China, right? I mean, they basically are not seeing any more new cases in Wuhan, which is where it started. So yes, this is a temporary phase. Yes, it's going to be painful for a little bit of time, but things are going to get back to normal.
Exactly. And that's where we need to put our thoughts. And that's where we need to put our focus, is that this is temporary. We need to see the silver lining in, some of us are going to have some extra time with our family. You know what? That's a blessing. Some of us, it might affect business in one way or another, but what are you going to make of it? Are you going to be the ostrich, or are you going to look for the opportunity amidst, this crisis? So
what messaging should you be doing? And I know it's a topic that is outside of the external marketing realm, but what should you be doing with your internal patients, existing patients that are already there?
Of course. And we do a lot of custom content creation for people as well. So we have some people reaching out, help us. Can you read this letter? Can you look at this? How does this look? How does this sound? For me, it's always about your brand. It's always about knowing who you are and what you stand for, and, applying that message to your marketing. So in any message that you put out, you can be true to who you are. Unless, your message right now is, say you're the funny dentist, you don't really want to make a joke of this. So you may want to dial it back a little bit, but you just go back to those core values. Who are you? What do you stand for? And then you reply accordingly. So I wouldn't overthink it. And you don't want to add to the fear and the panic. You want to add to the security and the safety. So an e-blast that you've crafted, a text message that you can send out, letters, definitely verbiage that you can use on the phone, and the more people that you can talk to. And collectively, we need to be spreading a message of security and unity and humanity, and everything is going to be okay. Like, people just need to hear that right now more than ever.
Right, because when you turn the TV on, it seems like the world is ending, and I agree with that. I think as health providers and practitioners, it's even more important to relay that message. What are you seeing so far? What kind of chatter are you hearing from your clients? Anything interesting?
I haven't really honestly seen a whole lot of change.
Okay.
I've been very just bold about my perspective on that this is temporary. And if anything, people are calling for guidance on how to put out the right marketing messages. So fortunately, I haven't seen people treating this like doomsday, but I tend to attract and work really well with people who are business minded. So, my particular target market are people who kind of think like me. And so maybe that's why I'm not seeing as much. We're more of a boutique marketing agency. So I haven't really seen any change. Besides the fact that people are just kind of like waiting right now. They're kind of watching and seeing, okay, what is this going to look like? So.
Okay. Well, good. So I guess to sum up our conversation, I think your advice to dental practices today are, don't hunker down, but maybe take this opportunity to really reach out to your prospective customers and educate them on who you are as a practice and your protocols that'll keep them safe. Right. So definitely use this as an opportunity to reach out to your community.
My message is go after it. Let your competitors stick their head in the sand and go after it. Continue. Put your message out. Market more. And when you feel that pressure to pull back is when you should actually be putting more in.
So market more is number one. Number two, have a communication strategy in place, correct? Because
that's unique to your brand, that considers who you are.
But that also kind of puts their mind at ease if they have questions about the coronavirus, right? So make sure you have a consistent communication strategy that says, if they say this, then that's what we're going to say, and have that, so that giving them the confidence that your doctor is aware of this, and we have taken all the precautions, and we're welcoming, and especially obviously if your kids are out of school, for example, right? Kids are out of school in many states. It may be a good time to bring them in and take care of this stuff. So maybe a communication strategy around that, maybe marketing messaging around that.
Absolutely.
Would be a good idea.
Yep. And lastly, we talked about being the leader for your team that gives your team confidence and security.
I think market more, have a consistent, good communication strategy, and give confidence to your team members that everything is going to be okay. Great 3 takeaways from this call today. I really appreciate you coming on a very short notice. We're definitely going to stay ahead of this, and we're going to continue communicating to our audience, our community that we love, the dentistry, right? We love this industry so much, and we're going to put out positive messages throughout this period to let everybody know that it's going to be a great 2020.
It's going to be okay. This is a moment in time, and yes, it's a big change, but everything's going to be okay.
Grace Rizza is pretty amazing. If you want to follow her on Facebook at Identity Dental Marketing, or even go to her website and check the stuff that she puts out. Very abundant in terms of her mindset. She provides all this information for free, to everybody, not just her clients, and it benefits me a lot. So I appreciate your sharing your wisdom with everybody. And thank you so much for attending today's webinar, and I'm sure I'll talk to you soon.